Hello, good evening. Welcome to all of our families. We are just going to wait a few minutes while families continue to trickle in, and then we will get started. So bear with us. I'm just going to wait one more minute and then we'll get started with our webinar this evening. All right. Hello, families. If it's evening, good evening. If it's day, good day, wherever you are in the world. We are thrilled that you're here with us for this webinar today on health and wellness. My name is Grace Sullivan-Zirkle. I serve as the Associate Director in New Student and Family Programs. And one of my privileges of my role is getting to work with our undergraduate families and equipping you all with the information to help support your students in their journey here at Duke. So we are thrilled to bring back our parent and family webinar series. This is our first of the semester, and we are aiming to host one every month this semester, again, to sort of introduce you all more to the life of Duke, resources available, what life at Duke might look like for your student, so you can share in that and experience that. Before I introduce or pass the mic to our presenters for today, just a few housekeeping items. First, we're recording this webinar, so if you missed that little thing, you'll be able to watch this back and get some more details, write them down, rewatch all of that. If you'll give us about 48 hours after this webinar ends, we'll get it posted on our website on the Parent and Families page. That just allows us time to transcribe it and make sure it's captioned before it goes online. Secondly, there is an opportunity to ask questions. We hope to have some time to ask some questions of our panelists. There's a lot of content to get through, so I doubt we'll be able to get to every question, but please don't hesitate to put questions in the Q&A below. You'll see it down there. You can ask that or put questions in there as they come up throughout the presentation, or wait until our speakers are done presenting. So any way that you would like. All right, well, we are really excited to have many of our directors and staff members from our health and wellness units at Duke. Today, we have staff from DuWell, Duke Reach, CAPS, and Student Health. In the past few years, we've had a lot of new leadership, and I guess we continue to reprioritize wellness at Duke. And so I'm excited for some of you to meet some of the staff on the screen for the first time and to hear directly from them what they do, ways that they're continuing to think about how we promote health and wellness and well-being within our student community. So let's get started. I'm going to first pass things off to our director of DuWell, Tom Zigathy.
Thanks, Grace. Hi, everybody. My name is Tom Zigathy, the Associate Dean Director of DuWell, and I am just bringing up my slides here. I only have a couple slides I want to go over with you, and then pass it on to some of my colleagues to talk about their areas. But DuWell is the public outreach education side of all the wellness units. So we address a number of different categories. First is some risk mitigation around teaching about healthy relationships and substance use, and different choices that your students might have as they come to campus, and how to navigate those choices in a way that's going to be safe for them. Our second bucket of influence, if you want to put it that way, is individual wellness development. And we're trying to teach additional tools to students. Oftentimes, students come to us thinking, as long as they're not sick or coughing or having a fever, that they're healthy and they're well. And we're trying to expand their definition of wellness to include a lot more than that, and to think about wellness, even as a point of if I'm homesick or I'm uncomfortable or struggling with something, how do I reach out? How do I address it? How do I utilize friendships or advisors or coaches, or even just taking a break from the busyness and hecticness of Duke to give myself a spot just to regroup, and teaching tools to go with that. And the third bucket for that is really thinking about, once I understand my risk and once I understand how to promote wellness and well-being, how do I give back to the community? Two of the big programs that we host, one is Koru, which is teaching students breathing exercises and meditation to facilitate a meditative practice. And we do that because that really advocates or helps them to focus. It increases the immune system, increases the sense of self-compassion, and which is really a huge chunk of what is helpful for them. Really having a positive self-talk to keep themselves motivated and heading in the right direction. And then the other component that we do is called Moments of Mindfulness. And this is a program that helps students really identify with areas or elements of things that give them purpose and meaning. Most of these activities are creatively based. It keeps them in the center moment, present moment. That really helps them to navigate stress and manage it in a way that it doesn't become debilitating. So we're trying to help them to have a daily practice of resilient behaviors rather than not thinking about their wellness unless they're sick physically. The programs in Moments of Mindfulness are student facilitated. They help to build relationships naturally around a common interest, having healthy communications with each other. A big focus on all of our resilient behaviors is how to manage stress and hopefully lower anxiety, and giving them a sense of purpose and meaning in the things that they are involved with. On our website, we have a list of all these different programs for people to come to. In some ways, it might look like very simplistic things, as you can see in these pictures of paint night and learning magic tricks and drumming circles and yoga classes and things like that. But really, these are elements. Each individual piece has been researched to show how it helps people manage stress. And that creativity helps people think about things in a different way rather than just one solution to a problem or an issue. And it helps them to become more open to various methods of dealing with things. It also gives them a sense of fun and enjoyment and laughter, which actually does help to lower stress and anxiety. And you may wonder why I'm constantly referencing stress and anxiety, but in our health surveys on campus, those tend to be the top two things that impact academic success. So we're constantly trying to help students to learn how to manage their stress. Oftentimes when we get very busy and our schedules get very tight, it's easy to forget to have fun because we're too serious about life and busy to get all the work done. But if we take a breather, if we take 5 or 10 minutes to laugh and have a good time, it lowers that stress so that I can stay more focused on my work and be more efficient in the work that I do. One of the adages that we teach our students is to talk about the idea that for every hour of studying, there should be 10 minutes of free time or play. You'll retain more information if you study for 50 minutes and have 10 minutes of free time than if they study the full hour right through. And these are some of the results of our programs in regards to helping students to manage stress and daily stress, building the friendships, building self-compassion, and building a sense of purpose and meaning. These numbers have been consistent over the 5 years that we've been doing these programs. And so our hope is that we're increasing the toolbox of what your students have available to them in order to manage all the stressors that come at them. And with that, a very short amount of time, I'm going to be handing this over to Sarah Peacock, who is our director of Duke Reach, to explain services at Duke Reach.
Hi, everyone. Give me just 1 minute to pull up my presentation here. All right. Well, good day, everyone. My name is Sarah Peacock, and I am the director of Duke Reach and Associate Dean of Students. My background is in mental health, but I've been working in higher education case management for just about a decade. So I like to start off by talking about who we are, and so you can see our faces and who you'll be interacting with if you contact us. So to my right in this photo is Tiara Wade, our Associate Director and Assistant Dean of Students. And then bottom left, we have Shelvis Pons, who is one of our case managers and Assistant Dean of Students. Amanda Roziski is our other case manager and Assistant Dean of Students. And then we have Danita Horton there at the bottom right, who is our Student Support Coordinator. And Danita is probably who you would encounter if you stopped by our office or gave our office a call. We also have 2 graduate assistant students who have been working with us this academic year. So I want to just give a brief history of what higher education case management is. So case managers started becoming more prevalent on college campuses following the Virginia Tech shootings in 2007. After that incident occurred, it was determined that there were several people on that campus who were concerned about that particular student who carried out that act. And there were some various offices who had documentation of concerns about the student, but there wasn't one area that was pulling all of that information together. And so from that came what we refer to as behavioral intervention teams, or BITs, which is a team of folks from all across campus who meet to discuss students who maybe are exhibiting concerning or threatening behavior and help connect them to resources. So the foundation of what we do is basically twofold. So we offer student support, so getting students connected to resources both on and off campus, and then intervention. If we have students who are exhibiting concerning or threatening behavior, we assess that behavior, and then we determine what might be a good next step to support the individual needs of that student, balanced with the needs of the campus community as a whole. So over the years, the areas of assistance that case managers in higher ed are sort of working with has evolved quite a bit. So some recent trends that we've seen in this area over the past couple of years are more involvement in sexual misconduct in Title IX, and also an uptick in basic needs assistance requests. So students who are experiencing maybe food insecurity or a financial emergency, or perhaps they find themselves unhoused for a period of time, and we are working to connect that student with resources in that area. An important thing to note about case managers, non-clinical case managers, is that we are non-clinical, meaning we don't provide therapeutic services. Many of us are licensed, but we don't provide ongoing therapy. And we are also non-confidential. So we cannot guarantee confidentiality when we have students come in. We only share information as it's necessary, and we value privacy, of course, but a big part of what we do is sharing information so that we can get that student connected to an appropriate resource. So we try to make that clear going in, that we cannot guarantee confidentiality as CAPS might be able to do. So what do? So we do connect students to resources, really anything that might come up that would serve as a barrier to that student's success or progression as a student. We will take that information in and help the student identify anything that might be helpful for them, whether it be on campus or off campus. So some examples of issues that students want to talk to us about range from anything from just a simple, roommate issue, homesickness, up to a serious mental health concern or a medical issue. We also have students who are experiencing family emergencies, academic concerns, really anything that might get in their way. We're a good place to come if you're just not sure where else to go. We do assess concerning or threatening behavior. So we do have students who are reported to us who maybe they're not violating any policies, they're just acting differently, or they're acting strangely, maybe acting in a way that's out of character for them. And we'll try to connect with that student to help determine what's going on. We also consult with campus partners. So we might find ourselves in a situation where there is a student that is showing up in multiple areas, and we are trying to determine kind of how those areas are connected and how we can support that student in each of those spaces. And then finally, we track reporting trends. So we are looking as case managers not only at the referrals and the trends that we're seeing on our campus, but we communicate with our partners across the country to sort of see what are you seeing in your area, what sort of trends are students showing up with, so that we can kind of track those patterns and look at behavioral trends. So some setting us apart from other campus resources, again, we don't provide clinical services. We are primarily a referral agent, but we also will meet long-term with students as needed, but we do not see them for therapeutic services. We also don't need to act as gatekeepers, meaning you don't have to go through Duke Reach in order to access another service. So if you know that what a student needs is, let's say, they need clinical counseling, that is certainly something that the student can access directly through CAP. So you don't have to go through us first. But we certainly, a lot of times it can be confusing and students aren't sure what resource is most appropriate. And so we're a good place to start in that situation. And then we also don't serve as a substitute for a more appropriate resource. So if you have a student who, let's say they're waiting for an appointment somewhere else, we are not best suited to serve as a substitute for that service that they're seeking, but we can certainly offer support in the meantime and help sort of get them through that period until they get to the appropriate resource. So some times when you might want to contact our office. If you do have a student you're concerned about, please submit a referral on the Duke Reach website, and we'll be sure and put that in the chat. Submitting this referral is the best way to get information to us. One, because it's in your words, the person reporting it. And two, when that form is used, it automatically feeds into our database and allows us to go ahead and start tracking that situation. So just for ease of communication sharing, that's usually the quickest way to get information to us. And we also have multiple people in our office who have eyes on those reports coming in. And you can fill that form out anonymously. So if you don't want to be connected to the information, but you feel it's important to pass it on, that referral form is an option for you. Sometimes you might not be sure whether or not something is reportable. We usually encourage folks to report no matter what. You don't have to decide if it's important. We can make that decision. You may have a very small piece of a larger puzzle that's helpful for us. But if you want to reach out and talk to one of us, just to sort of talk through a hypothetical situation before you actually take any action, we are happy to kind of walk you through that and determine what might be best. So please feel free to give us a call or send us an email if you're not quite sure whether you want to submit that referral. We also offer support services for our campus. So sometimes we'll come and speak with a class about what we do and about student support. We give presentations on campus. We do tabling at events, and we're always happy to partner with all of our campus partners to raise awareness for what we do, and also just raise awareness for resources in general. I try to tell folks when I give these presentations that, we are not the depression police. Everyone feels depressed and anxious from time to time. But when it becomes an issue is really when it's interfering with your daily life. And so we want to kind of try to get in before that happens, when we start seeing those initial signs of concern, so that we can go ahead and head that off and connect that student to resources before it becomes a bigger problem. And then, of course, general questions. So if you have general questions about your student, about any trends that you're seeing across campus in general, we are happy to talk through those and have a conversation about the services that we can provide. And this is actually the link to our referral form, which is a little bit hard to remember, of course, but we will make sure and get that link in the chat for you all. And I will go ahead and stop share and pass it over to my colleagues in CAPS.
Hi, everybody. Good afternoon. Dr. Lisa Adams. I'm the director of CAPS, and I'm here with my colleague. Ty, why don't you go first while I do the screen share, if you don't mind?
No problem. Hello, I am Dr. Ty Strong-Lewidor. I am the Assistant Director of Communications and Outreach here at CAPS, which means your students get to interact with me outside of the counseling room and doing different activities and other things geared toward wellness and psychoeducation, and learning how we can focus on prevention as well as intervention.
Yay, I always feel like a tiny victory when I get the slides up and running, so tiny victories, we'll take them. I've been at Duke for a little over a year, really happy to be here. We have such a great team that works with students on all of these sorts of issues. And we're gonna briefly kind of run through what CAPS does, but it's counseling and psychological services. And the main service that we provide is free confidential counseling and psychiatry for students. We do work on a brief counseling model. We don't count really heavily. We try to do what the student needs. And sometimes a student might, we know that most students work through their issue in maybe 6 sessions. Sometimes students need more than that, 12, 15, something like that. And so we try to really work with the student in front of us. We are really lucky to be in Durham, North Carolina, and have Duke Health System right here. And so they are also able to provide lots of specialty services. And so we're really a referral hub for anything to do with psychology for students. So just want to make sure that we're letting you guys know that as well. We also do group therapy. We have several DBT groups and other kinds of groups. All that info is on our website. We have psychiatrists, as I said, who do medication evaluation and follow-up. We have a track team, which is really our triage team, triage referral access and crisis team, and they're sort of on standby 24 hours a day. Students can just walk in walk-in hours 9 to 4 most days and 9 to 6 on Tuesdays, and someone will meet with them usually pretty quickly. Occasionally, like everyone wants to show up right before 4 o'clock, and then sometimes it takes a little longer, but for the most part, we see students right away. I already talked about referrals. One of the things that's still a little bit different at Duke is when we refer a student off campus, generally we're referring to what we call the Duke CAPS panel. And those are mental health providers in the community that we have vetted. And so they interview with us and we sort of know what they're about and what their specialties and strengths are, and making sure we're making a good match for students. And we do follow up and talk with students, try to talk to students when we make a referral. So it's not just a referral and you never hear from them again. So I think that's a good thing. Where's this? There it is. Services are available online, on Zoom, and in person. And we just kind of do what the student likes to do. This slide is about our telehealth service. We partner with Timely Care, and they provide 24/7 service for students. So if a student is struggling, it doesn't even have to be mental health related if they're just having a rough moment. Talk Now is a great feature for that. And then they also have ongoing care for students. And so there's a QR code there. Students can go in there, check it out. There's also some self-care content that we like. This is also free for students. So we find a lot of students who have like long labs and those kinds of things where they have trouble getting in during business hours find that Timely Care is a really good piece for them. You'll hear a lot of people call this Blue Devil's Care. And that's totally fine. That was the old name. New name is Timely Care. And so we have a good many students that use that service and like it and get really good results from that as well. So we're glad to be able to offer a really full array of services. And I'm gonna go to the next slide, if it will advance, which is not wanting to do. There we go. I'm going to quickly talk about gender violence, and then I promise I'm going to get to my colleague, Ty. Gender violence intervention we have a counselor dedicated just for working with students around the issues of gender violence. She primarily works in intervention, but does also work with our campus partners in prevention. I think you guys will find out more about that later. But we do clinical care management for students who've experienced stalking, sexual assault, relationship violence, sexual harassment. And the goal really of our work here is to really empower students who may have been through really tough situations. There's 2 ways that students can access gender violence intervention services. The first is they can walk into CAPS and go through our triage system, or they can go directly to the Gender Violence Intervention Coordinator, and there's her phone number there and her email. She monitors those 24/7. So if a student needs attention, in the middle of the night or whatever, she's taking a look at those. It doesn't, she'll pick up the phone, the emails, maybe a slower response rate, but she'll triage there in the middle of the night for students if that's needed. And so we're happy to be able to offer that in CAPS. It is a confidential resource, as are all of our other resources. But the gender violence intervention specialists make sure that students really understand all the resources that are available to them on campus. And that's a really important part of this work. I think I'm going to turn the next slide over to Dr. Louis Dorr.
Hi, thank you. And before I discuss the slide, I did notice a question in the chat regarding the number of sessions that students have. We've heard the rumors, and one of the things that we're really trying to put out there for students is that please do away with what you've heard and come check us out and see for yourselves. We tailor our services for each student, which is to say, some students may only need 2 sessions, some students may only need 6 sessions. However, if a student is working with us and we see that they may need continued service and they may best benefit from receiving that service from us, then we will continue to see that student. I promise we do not just dismiss students after a certain number, but thank you for putting that out there, because that means I need to start updating our socials with the myths and facts of CAPS. So thank you for giving me my next series to do. But in terms of connecting students to mental health services.
So sorry.
Oh, you're fine.
Sorry.
In terms, if there is a mental health crisis after hours, if there is urgent, call DUPD or 911. Dean on call if there's not an imminent risk present. But if it needs outreach within hours, because Dean on call is not confidential, so they will let us know if there's a student that we need to reach out to. Timely care is one that you can use. Unfortunately, timely care is only geared towards mental health services. However, when student health comes up, I wonder if they may be able to touch on a service that allows the students may not have to go to the ER. And then non-urgent outreach, as you saw Sarah mention, the student of concern report. Now, if it's during the day and we are open, please have your student walk over to CAPS. If it's urgent, imminent risk, then at that point, we may need to call 911. However, if we are open and we can help that student, please feel free to have them walk in. If they have a friend with them to walk them over, we can do that and we can meet with them then. As a matter of fact, one of the things that we teach students in a QPR, question per se referred, which is a suicide prevention training that students have access to here. This is how we help you save a life. This is how we help you save a friend. If you are here during the day, please call CAPS, please walk them to us. If not, call 911.
I just noticed I've got the wrong hours on there, but we are,
Update that.
we do have walk-ins Monday, Wednesday, Thursday, Friday, 9 to 4, and Tuesdays, 9 to 6. So bummer. Hate it when I have the slide wrong. And I think the last thing is, therapy takes time. It's not a come to CAPS one time and, you're miraculously healed. I wish we could do that. But, encourage students if they say they came to CAPS and it didn't really help, sometimes they just need to re-engage and continue to come back, give it a few sessions. If they feel like they didn't have a great fit with their counselor, they can ask at the front desk or give us a call, shoot me an email, let me know, like, I don't think that counselor was a good fit, and we'll find the right place for them. I've given you guys my name, my email, my phone number. Please don't hesitate to call or email me with questions that you might have. And Ty, is there anything that we want to close with as we hand it over to student health?
No, I think we said everything. And again, please encourage your students to come see us.
Thank you.
Okay, my name's Hunter Spots. I'm the Clinic Medical Director at Student Health. Let me just give me a second. I'm going to share my screen. I appreciate everybody being on tonight. As a parent of a recent college graduate, I've been through the process and I know it's a lot to digest. I'm hoping everybody can see what I have up now. Just a picture of our building. And our website, web address. We are located at the corner of Tower View Drive and Union Drive. We're across the street from Cameron Indoor Stadium, and you can see the chapel in the background. This is pretty much at the heart of campus. We're right also in the vicinity of the Broadhead Center and the Bryan Center, where there's a lot of student activity. Our office is located on the 2nd floor, which from Tower View Drive is street level. So, as a college student health center, there's a range of services that we provide to meet a lot of different needs of the students. Of course, we provide primary and acute medical care for the entire student population. Not only are we seeing the undergraduate student population, but we're seeing the grad and professional students as well. We don't see faculty or staff. We are totally dedicated to the students. We are not equipped to be an emergency room. However, there is an emergency room right on campus, should that need ever arise. Along with our primary and acute medical care services, we have nutrition counseling. We have 2 dietitians on staff. Students can self-refer, or at the advice of one of our medical providers can be referred to one of our dietitians. We have an immunization clinic that is staffed by RNs. Students throughout the school year may need immunizations. They may be getting an immunization series of some sort and due for a vaccine, and they can schedule appointments in our immunization clinic to receive those vaccines. Of course, we have our state required vaccines, and sometimes there's students still needing to get some of those doses after they've arrived at Duke. We have an allergy shot clinic. We have a number of students who receive allergy shots. We do not provide allergy testing. However, this is to serve students who have allergists and are seeing allergists home or on allergy shots, and they need to continue that care while they're at Duke. It is a very detail-oriented process of acquiring orders and transferring the allergy shots, but we have a nurse who does an outstanding job of coordinating that and who reaches out to the allergists for documentation and orders. Travel is a huge part of the Duke experience, for the international travel. We have a travel clinic that's accessible to students for individual appointments for both their Duke-related travel and their personal travel. And we also, during the spring, put on large-scale travel clinics for Duke groups that will be traveling abroad in the summer. We do have an X-ray machine in our office. It is dependent on X-ray tech availability. So there are times we do need to have students get X-rays over at the medical center. And we do not have CT or MRI, but those are accessible to the medical center as well. On site, we do have a laboratory. We can readily provide rapid tests such as flu tests, strep tests, monospot, and even COVID molecular testing at this point. For any lab blood work that's needed, we can draw that blood on site and send that out to the appropriate lab. And what I think is a really good service that's available to students is that if they're still seeing a home physician or specialist who needs blood work, we have a procedure where those physicians can transmit to us orders. We can draw the blood, the samples are run, and then results are sent to that directly to that referring provider. One of our big functions is to do processing and tracking of North Carolina and Duke immunization requirements. That is takes up a lot of our time and resources during the summer, and it's a process that continues into the school year. And I'll say a little bit more about it in another slide. And at this point, we're still doing some COVID case management. I don't know for next school year whether that will still be around. That is still to be determined. And I'll just put out there that we do not yet know what any COVID vaccine requirements will be for next school year. That is still being determined by a working group that will determine what, both for students and employees, what vaccinations will be required if going forward. Okay. We offer a full scope of primary care. We have a medical staff that includes MDs, that are School of Medicine faculty. We also have nurse practitioners, physician assistants, RNs, and registered dietitians, as I mentioned. We have a primary sports medicine physician who comes to student health 2 half days a week to see students. And we have an endocrinologist who comes a half day per month. his function is primarily to take care of students who require insulin for diabetes, but he sees students for other endocrinology needs as well. We offer a welcoming and inclusive environment for diverse constituencies, which includes services for our LGBTQIA community. And we have referral coordinators on site who assist students when they need to see a specialist in the Duke Health system. They can see on site our referral coordinators who will help them schedule appointments, time and place. And I think the students really appreciate that. That being said, we also have students coming in who maybe have some chronic medical conditions. They need to see specialists at Duke and want to transfer their care. And so if there's a situation such as that, students are welcome to schedule an appointment with us. We can discuss their needs and get the ball rolling for the appropriate specialty referral, so they can get the care they need here at Duke. In the student health world, our year is truly divided into seasons. As I mentioned, during the summer, we have a lot of effort going into immunization record review. We're still seeing some students, summer students, they're still grad and professional students who are on campus, and we're seeing them as well as residential campers. But many of our staff are redeployed to review over 5,000 records annually that come in that need to be reviewed, tracked for immunization compliance. At the beginning of the school year, really on the days around freshman move-in, in a conference space, Penn Pavilion, that's located adjacent to the Wellness Center, we put on a large-scale clinic for TB screening and immunizations. We have a large number of international students, many of whom are required to get TB screening. Also, there are students who come to campus and they're still lacking in some vaccines they need for state compliance. And so we put on a big clinic to take care of those students. And typically we see over 2,000 students. This past year, we had the clinic open on the 2 days before freshman day, on freshman day, which was a Saturday, and then Monday through Friday the following week. And so that's a big event we put on every year. Early fall, we're going to see the freshman play. Happens every year. We have students coming in from all over the world. Everybody brings their special viruses, COVID notwithstanding. And generally about mid-September, there's a lot of folks who are sick. Causes a lot of anxiety. And it's something that happens every year. It's going to happen. And I just want to put it out there that to be ready for that. We see any student that needs to be seen. Not all students want to be seen, but even if it's just for reassurance, we're happy to see any student who's ill, and we'll make sure that there's nothing serious occurring. And then we get that winds down, and then we get our annual flu season. So we have a bit of a redo after winter break. A lot of students who are sick, that's our busiest time for sick visits. During the midwinter, early spring, we start putting on our large-scale travel clinics. We have the various groups who are preparing for international travel in the summer. So we will put on travel clinics for these groups. And though this isn't for incoming freshmen, not something that's a thing for this year, when students become seniors and they're about to graduate, or grad and professional students who are about to finish their program and they're moving on to the next thing, oftentimes they need physicals or lab work or forms filled out or all of the above. So during the spring, getting into April, we see a lot of students for physicals. And just throughout the year, we're available for students to come in for physicals as well. This picture is to remind me to say something about immunization compliance. This past year at the Penn Pavilion event, I didn't get a picture, but this is a picture Let me back up a step. Immunizations for state requirements, the deadline is 30 days after the first day of school. And so this is a clinic we put on right before the deadline, a last chance clinic, if you will, for students still lacking some vaccine to meet the requirements. And also if there's students who are needing some sort of vaccine series, even if they're in the process and have gotten a vaccine, we have a lot of students we'll mark as partially compliant and they're good to go just so long as they're finishing up the vaccines that they need on the schedule that's for that vaccine. Our hours are essentially 8 to 4:30. Our busiest time during the day is the middle of the day. Students in general like to come between classes, so our doors stay open during lunch. We take a very short lunch break, sometimes no lunch break at all, and get students seen. Although we do have students walk in, we are a by appointment clinic. So we accommodate students as they call, walk in. I encourage they try to call. We do offer some appointments over the Duke My Chart, but same day appointments need to occur by phone call. And I'll go into that a little bit more. We do have nurse advice available 24/7, and we have our medical providers are on call after hours as well. And through Duke My Chart, once they've been seen at patients have been seen at Student Health and they've seen one of the medical providers, there's a lot of care that goes on via messaging over Student My Chart, and a lot of their needs we do meet through that mechanism as well. So appointments, visits are by appointment. We do have open access scheduling, and so we do have same day appointments available daily. Calling the phone number listed will help talk to a scheduler or one of our nurses for nurse advice. As I said, we do have some appointments online for advanced scheduling. We don't do same day scheduling through Duke My Chart because we've experienced in the past that the appointments get used up, and our highest no-show rate is from the appointments that were made online. So we don't want appointments going wasted that someone else could have. And when students need follow-up appointments, we can make the appointments in the room before they leave so that they can walk out with a follow-up appointment. We have video visits that are still available, not to the extent that we did during COVID, where we were doing so much of our care via video visits. But there's still video visits that we offer, and the students find that valuable for certain circumstances. I have a couple of key email addresses here. One is for immunizations. We do have an immunization coordinator, and we have a email address dedicated for immunizations for questions that anyone has about immunizations, their required immunizations. Do I need this? Do I not need this? How does this work? And likewise for insurance, as you know, students are required to have insurance, and there is a student plan that is the default, but there can be a waiver that's requested. My son, who just went through college, stayed on our insurance, and we went through a waiver process. So for any insurance questions, our insurance managers have a mail inbox that they monitor and are happy to help answer any questions that you have. And then finally, some key phone numbers. Again, our phone number for appointments and any nurse advice. And then Duke My Chart, we are on Epic as just as the rest of the institution is. And students can have a Duke My Chart account just like any other Duke Health patient. There is a 1-800 number that support line that you can call to help get set up with a Duke My Chart account. It's an online process for setting that up. And there's a access number that you need that you can get by calling this 1-800 number. And that is all I have. And so, Grace, I'm going to hand it back over to you.
Thank you so much, Dr. Spots, and all of our presenters. This is the time, if you have questions that are outstanding, if you can put them in the Q&A below, we are going to do our best to answer as many as we can in about the next 13 minutes. I know that our panelists have also been behind the screens trying to respond to specific questions if possible. I want to ask sort of a big picture question. Someone asked specifically, does Duke offer student wellness days where the whole campus is engaged in wellness activities? I'm wondering if Tom, but others can jump in if they'd like, could sort of talk about more of the holistic wellness promotion in ways in which students might interact with or see opportunities to sort of practice wellness, if not everyone together, sort of in their daily life.
Sure. Yeah. The university offered 2 or 3 days of wellness a year ago in the spring, and it was kind of right on the heels of the pandemic because of the amount of stress that students were really going through. The reason why we tend to advocate to build it into everything that exists at Duke rather than take a day or two off is that we really want students to be practicing wellness and well-being on a daily basis. So the programs that we offer that helps them and teaches them the tools to do that are offered 5 days a week. They can come, it's the same schedule each day of the week, Monday, Tuesday, Thursday, if each week is the same. So they can look it up, they can compare it to their class schedule, which is also the same every single week, in order to really input this behavior into their patterns in general. It tends to be more long lasting than to just make it a holiday. And the idea that we could restore ourselves in 1 or 2 days over the course of an entire semester.
Thank you, Tom. I appreciate it. As we talk sort of big picture, I wondered if anyone wanted to provide some guidance on partnering with parents, right? Families partnering with their students, and what might be some tips for making wellness a conversation between families and their students, especially proactive wellness. You're muted, Dr. Adams. I know, Zoom.
You think after 3 years, but I can speak to that. I have a senior in college, and I think the thing is to have those conversations to say, hey, when things are really tough, here's what you can do. Here's the things on campus. You can always text me, or what, everybody has a different relationship with their child, but I think that piece is really important to speak openly about it. There are days when you're going to feel really anxious. That doesn't necessarily mean you have an anxiety disorder, but it does mean you have anxiety, and you need to maybe be able to address that. And there's lots of resources on campus for that. And of course, your family is always a resource. And so I did that while I was driving my daughter to college. So she was locked in the car with me and couldn't get away. So that's my other piece of advice. I only mean that half joking, but getting your teenager to talk to you sometimes can be really really difficult. So, sometimes in the car, we can have those conversations that are a little less awkward that way. But that's one of the things that I did that worked and was really helpful. And I was texting with my daughter this week about, what do I do about my cold? Okay. Same thing we always say, but here we go. We'll do it again. They just need that continued support throughout the 4 years, I think, is the other piece. So.
I think the one thing I would add to what Lisa is saying as well is early and often. So if your student seems to be struggling or beginning to struggle, a lot of times they don't recognize the patterns of things that you taught them in the household and did that actually helps to mitigate the issue. And so just a reminder, and it can be something very simple. It could be taking the 10-minute break and going for a walk, or doing some journaling, or getting some of the worry out of your head and sharing it with a friend or a family member. They don't have to wait till they're at a 9 on a Likert scale of 1 to 10 before they get help. They could do it when they're just feeling uncomfortable at like a 2 on that scale.
There's a few questions about after hours care. I think it's particularly about student health, but I know there might be some an answer that CAPS wants to provide as well. You know, when it's hard to get an appointment, have we thought about having opportunities for appointments on the evening or on the weekends, and or how do students get medical support during the weekend?
Yeah, I'll take that first. As I said, the prime time that students come to us is in the middle of the day. They want to come in during classes, and this has been a recurring, question from year to year. After hours, weekends. We have experimented in the past with evenings and weekends, and without fail, the students don't use it to the extent needed, to justify staffing an office. As I said, we have an emergency room on campus for true emergencies, and Duke also has some very close by urgent care centers, and we do have nursing who's available 24/7 to answer questions, and so that we have met the needs of the students with that model, and currently we're staffed and budgeted for the hours that we are open for student health.
Lisa or Ty, do you all want to add anything to sort of after hour cares and thinking about expanding more opportunities for there to be appointments?
Yeah, we do have evening appointments if students need them. And we have the walk-in hours on Tuesday right now. That was the most used day. We've tried several different days of the week, and that seems to be the one where we got the most student traffic. But we also, if a student needs to be seen at 6 o'clock or something like that, we're able to do that. And then timely care is another great way because they can do Saturday, Sunday appointments, evenings, that kind of thing. So we have, I think, a pretty wide variety of options available for students in terms of mental health care. But students would just need to connect with us to find out what might be the best option for them. Because sometimes it's hard we actually have so many options for students. Sometimes that can be overwhelming. So just giving them a chance to come in and talk to one of our track team members is helpful in sort of narrowing down what might be the best option for that particular student. So we just encourage students to call or walk in or Zoom in, and we'll have a conversation with them about what might work best. We are also working on a 24-hour confidential crisis line, mental health crisis line, and we're really hopeful that any day now we'll have that up and running. So while that won't be regular appointments, that will be, crisis care available to students whenever they need it. So we're continuing to work and build and grow.
Thank you. I am thinking that Sarah, you might be a good one to answer this next question, but then other folks can join in if needed. So this question says, my freshman is experiencing anxiety and trying to figure out whether to contact CAPS, Duke Reach, or to use the mental health services provided by their own insurance, sort of the virtual options. He's confused where to start. So how can a family help support this student in figuring out where to start with care?
Yeah, so as I mentioned in my little piece here, Duke Reach is usually a good place to start. A lot of the answers to your question is going to depend on that student-specific situation. So have they been, do they have a regular therapist that they've already been working with? Perhaps they've had a negative experience engaging with a therapist and they're not sure that they want to go down that road again. Maybe they have sort of a complicated insurance situation. So Duke Reach is kind of a good place to start to tease some of those things out, where we can determine, okay, maybe this combination of services is going to be most helpful for this particular student. So it really depends on the individual student. And our office is a great place to start, whether the student self-refers with questions, or if you want to refer your student to Duke Reach on their behalf. Again, you can fill that out anonymously, or just tell them, hey, I'm going to refer you to Duke Reach because I can't answer your questions, and they can. So I would say we'd probably be a good place to start so we can dig into that student's individual experience.
Wonderful. We are coming to time. It is 5:56, and I want to honor our panelists who are spending their evenings with us and our families. Anyone want to provide any last comments before we wrap up for this evening? We are good. Well, on behalf of our families, I just want to honor our extreme thanks and gratitude, not only for your time this evening, but for continuing to support all of our students here at Duke and continuing to take the feedback that we're hearing from students and put it into action so that we can create a more well Duke community. So thank you so much to any of our families. If you feel like you still have questions that we didn't get to, please feel free to email our office, familyprograms@duke.edu, and we will do our best to get you to the right place, get answers to you. Again, this webinar is being recorded, so if you missed something, wanted to hear something again, if you give us about 24 or 48 hours, we will get it on our website so that you can review the recording. That'll be on the family page under communications. Stay tuned for more information from our office. We'll be announcing our February webinar shortly, and we hope that you will join us. So thank you again to our panelists. Have a great night.